And the question is, do you know how to price the treatment and control of bruxism? Most say no because they provide a mouth guard, sell a mouth guard, and I'm not a mouth guard seller, so they sell a mouth guard and that's it. It's over. It's over. There's no follow-up, no consultation, no understanding of the genesis of bruxism. So everything remains very loose. But I know that's how we were taught. You were taught this way, and so was I. But I'm here precisely so we can change together. This story. So what does a dentist usually do due to a lack of knowledge about differential diagnosis? They provide a mouth guard, do what's necessary for the teeth, and give a mouth guard. But as I told you, there are different types of bruxism, varying intensities, risks, cardiovascular diseases involved, and sleep apnea. And the flat mouth guard, the stabilizing guard, is not recommended for patients with sleep apnea because it can push the jaw further back. So we will have a sequence of dental treatment along with bruxism treatment, which I will explain. The 4 stages of bruxism treatment during the Advanced Dentistry Week. Join me for next week. Now, in terms of teeth, I made her differential diagnosis and will treat her bruxism. I will do environmental adjustment, mock-up, ceramic restorations, and then a mouth guard. Whether she has sleep apnea or not, what type of mouth guard, I want to ask you. So bruxism is a sleep-related movement disorder. The patient sleeps poorly. Now, this study I brought to you shows the following. Occlusal splints have been widely used in clinical practice. However, no evidence supports their role in stopping sleep bruxism. In other words, the splint only protects the teeth, and 20% of the patients in this study are increased their activity. In electromyography, EMG, electromyography, which is when you measure the movement of muscles when using silicone splints. Of course, you can't use silicone splints, folks. Why does the patient feel more comfortable with the silicone splint? Because it applies less pressure. And what happens when the patient feels pressure on the teeth from the bruxism splint? It recruits the periodontal ligament. If the splint is too tight, the patient will really feel discomfort due to the theory of proprioception. So the ideal splint needs to be tailored for the patient. No, don't make an Amazon type splint for every patient. Though the same for all, because if you only sell splints, they will compare you to Amazon. And any splint will be expensive. Compared to Amazon, which charges 15, 16, 30 reais on the free market. Bruxism splints, folks, they exist. Box with a pair. So look how interesting. It's crazy what we are experiencing. So if you want to know more about these topics, start following me and share with more dentists.